Welcome everybody for attending this briefing. As you all know and are well aware, we're currently looking at acquiring a failing rural hospital to extend our service area and to extend our market share in different areas. What we've identified and what we're going to present here is information for two facilities, Penobscot Valley Hospital and South Central Kansas Medical Center, both of which are having some financial hard times. In terms of financial acquisitions, we want to present this data and this information to better enable you the opportunity to get a better financial picture, overall picture of each of these organizations that we hope will help aid you in your decision to bring one of these organizations into the UNH family. We're first going to discuss Penobscot Valley Hospital. We'll refer to it as PVH. It's located in Lincoln, Maine. It was established in 1973 to serve the local population in the area, which is around 152,000 people, through 15 local towns. It's a 25-bed nonprofit hospital. It was originally founded to ensure that there was a formal medical facility that could provide services for local communities in rural Maine. Its mission statement is to be our community's first choice in healthcare, known for a culture of compassion, quality, and safety, to be an excellent community partner, working together every day to improve the health and well-being of those we serve. Its overall vision for the organization is to be recognized as the best place to receive care, work, and practice medicine. It provides an array of inpatient and outpatient services. It operates surgical services, emergency services, gynecological, public health services, illness community support groups. So we're looking at Alzheimer's support groups, cardiac support groups. When looking at patient discharge survey results, overall, it's an average rated facility. There are concerns from discharge results surrounding patient understanding of discharge instructions. There's a lack of willingness to recommend PVH for care on these discharged patients. But overall, the organization did rate above average in cleanliness and between nursing interactions. It's the organization was awarded or part of a group of rural hospitals in that area that were awarded a 3-year federal grant of $848,000. This was for the development of a Rural Health Innovation Network, or RIN. The goals of RIN are to essentially link rural hospitals to enable for better patient care of an aging population and a spread out population. The aim would be to achieve this through a development of a network to share ideas and information for a more communal approach to healthcare, especially in an area where resources are stretched. In 2014, PVH did see some financial hardships where they had to cut 10 full-time equivalents due to operating losses of $1.2 million. Administration attributes this to a declining local economy with a few local larger employers closing down in the area, fewer jobs, and a lack of state expansion of Medicare and Medicaid. Operating margin for the organization, operating revenue was just shy of $23 million. Total operating expenses were just shy of $24 million. So we're looking, once you calculate it out, to an operating margin of minus 4.58%, so a small operating gap. We're looking at a net margin. When we start looking at it a little bit more in detail, we're looking at a program service revenue of just shy of $23 million, with direct expenses being just shy of if you round up, $14 million. Net margin, when you calculate it out, looks about 38.6%, which means for every dollar that the organization spends, it's making 38.6 cents. Total revenue for PVH from Medicare and Medicaid, just over $9 million. Overall patient revenue for all services was just over $36 million. So we're looking at a smaller patient population that's Medicare and Medicaid related, and looking more at a population that's privately insured. Expenses from salaries and wages are basically $15 million. Numbers of staff that are making greater than $100,000 is 13 individuals. The organization operates office expenses for administrative tasks at $839,000, with overall medical supply expenses being $1.7 million. Well, debt for the organization, we have some accounts payable at $2.5 million, tax-exempt bond liabilities at $686,000, secured mortgages and notes payable at $4.6 million, third-party settlements and deferred compensation at just shy of $3 million. So we're looking at debt that's more structured. It's with lenders, it's structured payments, it's percentage rates and things of that nature. When it comes to our recommendations from a financial perspective, upon our review, the facility is operating at a minor operating loss. However, it has overall positive net profits, which is a good thing. With help from our organization and work processes that we currently utilize, that could potentially help them by streamlining and reducing the amounts of staff that they have that are required, which would decrease operating expenses. Our initial recommendation would be to look at the 13 members of the staff that currently make over $100,000 to see if we can get some cost savings that could come out from cutting a few of these positions if it's beneficial. Or they could be replaced with individuals that have comparable experience, because we don't want to diminish a service and quality of care, but maybe at a better rate. The next organization that we're going to look at is South Central Kansas Medical Center, or SCKMC. It's located in Arkansas City, Kansas. It's a for-profit hospital that serves a local population of just over 12,000 people, but it also serves neighboring districts and towns and things of that nature. It was established in 1906, where it was then purchased later on by a group of physicians in 1921 that incorporated it. The organization's mission statement is to continuously improve health through personalized and compassionate care close to home, with a vision statement that reads, "The facility is to serve as the foundation for our community's wellness and medical care through service, leadership, and community partnerships." The facility provides a vast array of inpatient and outpatient services, full spectrum of lab services, 24-hour acute care, emergency department, imaging services, social services, nuclear medicine. It's scored overall on patient discharge survey results as below average. There was an impression from patients that physicians demonstrated a lack of concern to properly explain medications to prevent harm when the individuals were home. Poor grades for facility cleanliness. There were average grades surrounding staff responsiveness and communications concerning care in regards to physicians specifically. SCKMC participates in a Kansas Hospital Engagement Network, or HEN, the goal of which is to improve patient safety. The facility has been able to reduce adverse events, hospital-acquired infections, and pressure ulcers by 17%, which is fairly impressive. In conjunction with the other HEN participating hospitals, there was a prevention of 3,800 patient safety-related events, which in turn has a price tag associated of a $23.2 million savings. The hospital is currently working through some financial issues, however. They're currently operating a loss and in substantial debt. Requires 2 loans from the city to cover bond payments of $575,000. Has outstanding debts of $21 million that they're currently working on structuring repayments for with the city. Operating margins, total operating revenue for the facility was just over $8 million, with total operating expenses at just over $11 million. We're looking at here, when we calculate it out, at a negative operating margin of 40%. Net margin, we're looking at service revenue of just over $2 million with direct expenses of $3.4 million roughly. We're looking at a net margin of minus 60%, or in general terms, for every dollar spent, the hospital is losing 60 cents. Total revenue for Medicare and Medicaid was about $790,000, $791,000. Overall patient revenue was $3.3 million. Total expense from salaries and wages was $8.2 million. Numbers of staff making greater than $100,000 is 0. There's no individuals outside of the administrative team. Office expenses are $307,000 and medical supply expenses were $522,000. The debt with South Central Kansas Medical Center is structured a little bit different than PVH. We do have accounts payable of $822,000, deferred revenue of $853,000. The big difference is the intercompany payables, which are at around $66 million. It looks like the facility was expanding and transferred funds to manage that expansion. For South Central Kansas Medical Center, we have one major recommendation. Upon reviewing the financial information, the facility is operating at a major loss, both in operating expense and net profit. We want to make sure that we ensure solvency of the organization by looking at the expansion of the facility and looking if we can liquidate some of those assets that could cover the debt that was caused by the intercompany payables to kind of recoup some of those costs. And we also want to look at, and recommend that we ensure that the other financial debt that are currently kind of hanging over the head of the organization are looked at so that we can remain fluent with this organization and the doors can remain open. I thank you so much for your time. References here for the information that was provided. If you have any questions, please do not hesitate to get in touch with me. You can reach me anytime. Just shoot me over an email, give me a call. I hope everybody has a good day, and I hope that this briefing was informational. All right. Have a good day.